Hey everyone, welcome back to Carewise. Before we start today's important topic, do me a quick favor, drop your name and the state you're watching from in the comments below. I want to see where everyone's tuning in from and find out who among you is planning smart for your healthcare. It's always great to know who's actually putting this knowledge into action instead of just listening and moving on. So go ahead, comment your name and state, I'll be checking them personally. Now, let's get to it. There's been a lot of buzz about whether Original Medicare will soon start requiring prior authorizations, and if you've heard bits and pieces about it, you might be wondering if this is something to worry about. Are we about to see more delays, denials, and paperwork in the traditional Medicare system? Will it become like Medicare Advantage plans where approvals sometimes stand between patients and the care they need? Well, the short answer is both yes and no, but definitely not in the way you might think. Today, we'll break down exactly what's happening, why this change is being introduced, and how it actually works to protect Medicare rather than restrict it. So first, let's get some context. Original Medicare, that's Parts A and B, was designed to cover everything that's medically necessary to diagnose or treat an illness, disease, or injury. The phrase, medically necessary, is crucial here because it's what determines whether Medicare pays for a service. For something to be medically necessary, it must be safe, effective, and accepted under standard medical practice. It can't be experimental or unproven. If your treatment meets those standards, Medicare covers it. That's the promise that's been in place for decades. But in the real world, the healthcare system isn't perfect. Sometimes, unfortunately, that trust is abused. Over the years, there have been billions of dollars in fraudulent claims filed against Medicare, things like fake patient identities, unnecessary tests, and billing for equipment that was never provided. These scams cost taxpayers and the Medicare Trust Fund an incredible amount of money every year. That's where the new change comes in. Starting in January 2026, Medicare is launching a pilot program called the Wasteful and Inappropriate Service Reduction Model, WISeR for short. It's a limited test program that will require prior authorizations for a small, specific set of medical services in certain states. But unlike the prior authorizations you may have heard horror stories about in Medicare Advantage plans, this program isn't designed to delay your care or deny necessary treatments. It's being put in place to reduce waste, fraud, and abuse in the system, the kind of abuse that steals billions of dollars from Medicare and drives up costs for everyone. Now, it's important to understand the difference in intent here. In Medicare Advantage plans, insurance companies use prior authorizations as a cost control measure. They get paid a flat monthly fee per enrollee, so every service they deny or delay boosts their profit margin. That's why so many people complain that Advantage plans limit their access to care or make it harder to see specialists. In contrast, Original Medicare doesn't operate for profit. It's a federal program administered by the government, not a private insurance company. When Medicare uses prior authorization, it's not to save money for shareholders, it's to protect the integrity of the program itself. For example, back in 2014, Medicare introduced a very limited prior authorization rule for certain durable medical equipment. The purpose wasn't to restrict patient access, but to stop fraudulent billing. Scammers had been charging Medicare for wheelchairs, braces, or medical devices that were never actually delivered to patients. By requiring prior authorization in those cases, Medicare drastically cut down on fraudulent claims. That's the same concept being expanded under the new WISeR model. Now, before we go further, if you're finding this information helpful, make sure to like this video and subscribe to Carewise. We bring you updates like this all the time to help you understand your benefits, avoid scams, and make the best decisions for your health coverage. A simple click helps support our work and ensures you don't miss future videos. Alright, let's continue. The WISeR program will begin in January 2026 and will initially roll out in 6 states, Arizona, New Jersey, Ohio, Oklahoma, Texas, and Washington. These states weren't chosen because they have higher fraud rates, but because they have enough patient data across a wide range of outpatient services to properly test the program. The pilot will focus on 17 categories of outpatient or ambulatory services. That means medical treatments or procedures that don't require an overnight hospital stay. These can include clinic visits, diagnostic tests, outpatient surgeries, and certain therapeutic procedures like injections. Over time, the program will analyze how effective these authorizations are in reducing unnecessary or fraudulent claims while maintaining patient care quality. The program is set to run through 2031. If it works well, meaning it reduces fraud and doesn't create unnecessary delays for legitimate care, then in 2032 it could be expanded to more states and possibly to more categories of medical services. So what kinds of problems is Medicare trying to solve here? Well, let's look at a few examples that led to this change. In recent years, investigators have uncovered multiple large-scale fraud schemes targeting Medicare. For instance, one investigation found that a criminal organization used stolen identities to file fake claims for urinary catheters and other medical equipment, resulting in over $10 billion in fraudulent claims. Another case exposed wound care companies billing Medicare for unnecessary amniotic graft procedures, creating hundreds of millions in false charges. There have even been telemedicine schemes where providers billed Medicare for consultations or prescriptions that never actually happened. Each of these scams may sound small on its own, but together they add up to billions of wasted taxpayer dollars every single year. That's money that should be going toward improving benefits, lowering costs, and protecting the long-term future of Medicare. The WISeR model uses modern tools like artificial intelligence and data analytics to detect these patterns early. The system looks for statistical red flags, for example, a provider who performs an unusually high number of a certain procedure compared to others in the same area, or one who consistently bills for the most expensive versions of a treatment. The AI system doesn't make the final decision, but it helps flag questionable cases for review by trained professionals. Human reviewers then make the ultimate call, approving, denying, or requesting more information. The goal isn't to interfere with legitimate doctors or delay medically necessary care. It's to catch the small percentage of cases that appear suspicious or wasteful before those claims are paid. Now, I know whenever people hear the phrase, artificial intelligence, in healthcare, it can sound concerning. You might think, great, now a computer is deciding whether I get treatment. But that's not how this works. The AI is simply a support tool, not a decision maker. Think of it like an early warning system. It helps Medicare identify patterns of overuse and potential fraud faster than humans could alone, but the final decision always involves a qualified medical reviewer. This combination of technology and expert oversight is designed to make the system more efficient and accurate, not more restrictive. According to the Centers for Medicare and Medicaid Services, the most common causes of waste in healthcare include financial incentives that reward quantity over quality, defensive medicine where doctors order unnecessary tests just to protect themselves legally, and patient-driven demand for services that may not actually be needed. The WISeR program aims to address all these issues by promoting accountability while still respecting clinical judgment. It's also worth clarifying who this program actually affects. If you're on Original Medicare as a patient, this change doesn't alter your benefits or coverage. You're not being asked to apply for prior authorizations yourself. The responsibility lies with the medical providers and facilities participating in the program. If your doctor or clinic is involved in WISeR, they'll handle the necessary paperwork behind the scenes. If you'd prefer to avoid it entirely, you can choose a provider who's not participating in the model. But since it's a limited test, your options probably won't change much. Most importantly, it would take an act of Congress to make this program mandatory for everyone nationwide. So, if you've been worried that Original Medicare is turning into Medicare Advantage with more red tape, don't be. The two systems might both use the term prior authorization, but their goals are completely opposite. Medicare Advantage plans often use it to limit costs and boost profits for insurance companies. Original Medicare, on the other hand, uses it as a safeguard, a way to protect your tax dollars, fight fraud, and make the entire program more sustainable for the future. In fact, if WISeR proves successful, the same technology could be used to monitor how private insurance plans handle prior authorizations. That means the AI system might eventually help identify when Medicare Advantage plans are denying or delaying necessary care, which could lead to more accountability for those insurers. That's a benefit for everyone. Now, let's take a moment to look at what this means long-term. Medicare is one of the most critical parts of the American healthcare system, serving more than 65 million people. Keeping it strong requires constant updates to prevent abuse. Every dollar lost to fraud or unnecessary billing is a dollar that could have gone toward improving benefits or lowering premiums. The WISeR model represents a modern approach to protecting the system, using technology, data, and evidence-based oversight instead of bureaucracy or blanket restrictions. It's a smarter way to make sure care remains available, affordable, and fair. For most beneficiaries, you'll likely never even notice these changes directly. If your care is legitimate, medically necessary, and properly documented, it should continue as usual. But behind the scenes, this program helps ensure that the system remains stable for years to come. It's like updating the locks on your house. You might not notice them day to day, but they keep your home safe. So what should you do right now? First, stay informed. Don't let rumors or fear about prior authorizations cause unnecessary stress. Keep in mind that this program begins in 2026, runs through 2031, and affects only a handful of states at first. It's not a national policy change, it's a test to gather data and improve the system. If you live in Arizona, New Jersey, Ohio, Oklahoma, Texas, or Washington, you may start hearing from your healthcare providers about it next year. Otherwise, you probably won't see any difference for now. Second, make sure your providers understand your coverage and communicate with you about any authorization requirements. Good providers already do this as part of their standard process. And third, continue paying attention to official updates from Medicare and reliable educational sources like Carewise. This is the kind of information that helps you stay a step ahead, avoid confusion, and protect yourself from misinformation. And speaking of staying informed, if you found this explanation helpful, take a moment to hit that like button and subscribe to our channel. We post regular updates about Medicare changes, Social Security, retirement planning, and healthcare policy, all explained in clear, professional language so you can make confident choices. Your support means a lot and helps us continue creating content that makes a real difference for seniors and families across the country. To sum it up, yes, some prior authorizations are coming to original Medicare, but this isn't the kind of change that restricts care. It's a strategic, targeted effort to fight fraud, reduce waste, and improve accountability. Unlike Medicare Advantage plans, where prior authorizations often serve as barriers, the WISeR program under Original Medicare is designed to make the system stronger, not smaller. It's about protecting the trust fund, maintaining access to care, and ensuring the long-term sustainability of the program we all rely on. So the next time someone tells you that Medicare is starting prior authorizations, as if it's bad news, you'll know the full story. This isn't a step backward, it's a modernization effort to protect patients, taxpayers, and the integrity of Medicare itself. Thanks for watching, and don't forget, drop your name and state in the comments below if you haven't already. I love seeing where everyone's joining from. If you want to stay updated on Medicare news and changes like this, make sure you're subscribed to Carewise and turn on notifications so you never miss an important update. Take care, stay informed, and I'll see you in the next video.